The experts make of the mask and testing debate, and what of spring break if travel is in your plans? Dr. Nicholas Testa is the Chief Medical Officer with Dignity Health Southern California. He joins us now. First off, good morning, Dr. Testa.
Good morning, Phil.
So a lot of debate, mask, no mask. Some people never wanted them in the first place. Some people don't want them, or they won't get rid of them now. What are your thoughts on that?
So personally, I still carry a mask with me. Both my kids do. My wife does. I just think that we have to monitor what's going on around us. COVID numbers are dropping across Los Angeles County, so I think we can be a little bit more confident about not wearing a mask as much. But my ask to society is that when those numbers come back up, be ready to put that mask back on. I think that we've politicized it into something that's a much bigger deal than it needs to be. If you look at other countries, they're much more accepting of masks, and I think it's because it's become part of the culture, and that's where I'd like to see us.
Well, when we talk about doing and being around people, that's spring breaks. For some, it's here now. Others are planning travel. What about a possible spike when people start coming back from spring break?
Sure. So we've seen surges after people get together. We've seen them after Thanksgiving, Christmas, other holidays. I think we can anticipate it with spring break and travel. So my recommendations are, firstly, get vaccinated if you're not. And if you are vaccinated, make sure you're up to date on your booster. And then when you travel, look at where you're going. Are you going to a place where we're seeing a surge of COVID? Are you coming from a place where we have a surge of COVID? And if so, you need to be extra cautious. You need to bring that bag of masks and wash your hands. And then also looking for travel advisories that are out there and make sure you're following the directions of the location where you're going.
Speaking of places people might be going, we're seeing a spike in Asia and Europe, and there's a lot of this concern with the BA2 subvariant. Trying to put it all into perspective, does the booster help you with that variant? Are we letting our guard down by maybe not getting the booster? That's a lot to unpack with one question.
A lot of information out there. So let's walk through a couple things. Firstly, the BA2 variant is a variant of the Omicron variant, so it's a subvariant that we're seeing in Asia and the United Kingdom. And why I particularly mention the United Kingdom is because what happens in the United Kingdom, we've seen typically leads by about 3 or 4 weeks what's going to happen in the United States. So they're seeing a rise in cases, they're seeing a rise in hospitalizations. We are seeing the BA2 variants in the United States. We are seeing it growing in the percent of cases that we're seeing. We're not seeing a surge in the United States yet, and we're not seeing a rise in hospitalizations. I mention that because we need to reset how we're thinking about COVID. It's not going away. COVID is here to stay. Our treatment strategy has to be decoupling disease from hospitalizations, right? So we have to bring all those countermeasures to bear and get our population vaccinated and be ready with therapeutics to treat those patients, right? Because we're going to see surges of COVID for the rest of our lives, okay? This is here to stay. It's really decoupling severe disease from those surges.
That has been it for a long time, right? The vaccine and treatment. But Dr. Testa, we've kind of run out of time. Thank you so much for joining us, and hope you have a good spring break whenever it comes.
You too, Phil. Take care. Thank you.